Thank you for taking my call. I'm a second-time caller, Premier Smith, and I'm really excited that you have brought a significant voice to the federal government that has continuously promoted an ideology of harm reduction that has really destroyed communities from coast to coast through homelessness, housing, and the drug use. I was really excited such a short period of time that you introducing the recovery model. I have some really good friends that attended the conference in Calgary, and really to kind of really increase that support to finding families that have only previously had such short term or there's only the ideology of just use the Suboxone and so forth. I've been a social worker for almost 40 years, and I have never seen such suffering from individuals and their families. And just recently in this past week, I promoted and shared the recovery model with some adult parents who really are struggling with their adult children as well. So I'm very, very excited to see this. And the other thought I had in seeing how the model is in Red Deer, is there any thoughts to having such a model that really sort of integrates the adolescent piece? Because as we know, children or adolescents that struggle with drug use and so forth, is that if they incorporated a longer term treatment that also included their education and family counseling. So we're really blessed to have you as our premier in Alberta, and I thank you for your service.
Well, thank you for your work as well, because it is not easy being on the front line, seeing the kind of tragedies that you have to see every day. I would say there's a couple of things. We have been funding mental health support in the schools through our education ministry. But you might be interested in looking at the Sheldon Kennedy Child Advocacy Center in Red Deer, because it was created after a tragic story of a 15-year-old girl who took her own life, and her family decided to raise some money so that they could create a mental health facility to be able to help kids in distress. So they have a 16-bed inpatient facility that we did the ribbon cutting on it last year. And they also have outpatient. And we're thinking that might be the model to roll out in the rest of the province. So we're just waiting to see what kind of results they have. But I've heard already that there's some good results there. The second part about our recovery-oriented system of care, we have Red Deer up and running. Yeah, Red Deer's kind of a center for good ideas. And so we've got the first one in Red Deer. The second one came open in Lethbridge. We've got 9 more to come, and we'll be rolling those out. I think we'll have all of them completed within the next 2 years. So that will add, in total, my goodness, I think we're talking about adding 1,000 beds in total that are going to be focused on mental health and addiction treatment, which will take the pressure off our hospitals. So we think that this is the right approach. And I should just mention, you might be wanting to watch what's happening next door in British Columbia, because I don't think that their decriminalization experiment is going to last long.
There was a story on the news last night where they referred to what had happened in Portland, Oregon, and one of the paramedics in Portland was telling BC, don't do what we've done.
And in fact, I think that mental health minister at the federal level is going to check and see whether or not they should continue with the decriminalization approach in British Columbia. There were officers who gave testimony to the House of Commons last week. They're at a point now where it's basically a free-for-all. They can't stop addicts from smoking up in parks near kids. They can't take their drug paraphernalia away from them when they're in hospital. They're asking nurses to fill up their crack pipes. They are not able to confiscate weapons from them. They can't stop drug dealers from coming in, and it's becoming a real problem. And the worst part is it's not actually reducing opioid deaths. That's what I think the safe supply folks have said is, well, if you give people a safer supply of drugs, then it will reduce the amount of deaths. It's not the case. We had, sadly, 1,700 opioid deaths last year. British Columbia had, I believe, 2,500, and we're about a similar size population. So I think they've gone down a path. They gave it a try, and I think we're beginning to see that it's putting too much pressure on the community and also on the hard working frontline nurses as well. It's creating a real workplace safety problem for them.